Using the repositioning sling, slide sheet, and portable lift to assist with Peri care or incontinence care. This patient is not able to follow commands and is not able to assist with weight shifting on the bed. This task requires a minimum of 2 caregivers. Place the carry bar of the portable lift directly over the patient's midsection and lower the lift. The carry bar is supported by one of the caregivers at all times. The carry bar should be lowered close to the patient's body, but should never make direct contact. Attach the top 2 straps on the repositioning sling to the carry bar on the portable lift. Raise the carry bar until there is tension in the sling straps. Ensure the straps are securely placed on the lift carry bar. On the opposite side, drape the sling over the patient and place a folded slide sheet under the patient from head to toe. The slide sheet should be tucked as close to the patient's midline as possible. Move the pillow in the direction of the turn to ensure the patient's head is supported. Cross the patient's arms over his chest to keep upper extremities out of the way for the turn. If the patient can tolerate, bend the leg opposite the direction of the turn to assist with positioning. As the lift and sling are raised, the patient will turn onto one side. The caregiver may lightly push near the patient's shoulder and hip to keep the patient centered on the stretcher and to assist with a full turn. Once turned, the lower half of the sling may be tucked out of the way, giving the caregiver access for cleaning and care. To turn the patient in the opposite direction, return the patient to the supine position, disconnect the sling from the lift, and remove the slide sheet. Place the folded slide sheet under the sling on the other side of the stretcher. In small rooms, the lift may only fit on one side of the bed. Place the carry bar in the same position as before and attach the top 2 lifting straps on the opposite side of the sling. Raise the lift until there is tension in the straps. Ensure the sling straps are securely attached to the lift carry bar. Move the pillow in the direction of the turn, cross the patient's arms over his chest, and bend the leg opposite the direction of the turn if the patient can tolerate. As the patient rolls onto his side, the caregiver will lightly push on the shoulder and hip, just as before. The lower section of the sling is tucked out of the way, and caregivers may gain access for cleaning and care on the opposite side. Once the task is complete, guide the sling back to the correct position. Lower the lift and return the patient to the supine position. Disconnect the sling from the lift carry bar and ensure the patient is correctly positioned on the mattress surface. The slide sheet is removed and the sling is straightened under the patient to ensure there are no wrinkles or potential pressure areas. Remember, we never leave slide sheets under a patient.